Hello everyone, welcome back to Med with K. Today we'll be starting a new series that is Arteries of the Human Body, which is aimed to give you a comprehensive view of all the arteries of our human body. In this video, we'll be covering Subclavian Artery, Axillary Artery and Brachial Artery, which forms the important or the principal parts of the upper limb. This is the human heart. From the left ventricle, we have the ascending aorta, which continues as the arc of aorta. Now this arc of aorta, it starts or it begins behind the right sternocostal angle and ends behind the left sternocostal angle. The arc of aorta gives three branches which is responsible for the arterial system of the body. Number one is the brachiocephalic trunk. Second, we have the left common carotid artery. And at last, we have the left subclavian artery. We also have a small mnemonic that is BCL to remember this. Coming to brachiocephalic trunk, the first and the largest branch of the arc of aorta. A key point over here is the brachiocephalic trunk is present only on the right side. It is not present in the left side. Coming to the branches of the brachiocephalic trunk, it gives two branches. First is the right subclavian artery and second is the right common carotid artery. The right subclavian artery arises posterior to the right sternoclavicular joint and supplies neck and upper limb, whereas the right common carotid supplies neck and right side of the head. Here are the two subclavian arteries. One is the left subclavian artery, which directly arises from the arc of aorta, and then we have the right subclavian artery, which is a branch of the brachiocephalic trunk. Let us talk about some anatomy first. This is your scalenus anterior, this is your clavicle, this is your sternum, and this is your first rib. Now the clavicle and the sternum form a sternoclavicular joint. Now, talking about the course of the subclavian artery, the artery arches superolaterally, passing behind the scalenus anterior muscle over the first rib and then continues into the axilla as the axillary artery. It extends from behind the sternoclavicular joint to the outer border of the first rib, where it becomes the axillary artery. Based on the scalenus anterior muscle, the subclavian artery is divided into three parts. The first part, which is medial to the muscle, the second part, which is behind the muscle, and the third part, which is lateral to the muscle. The first part of the subclavian artery gives three main branches. Number one being the thyrocervical trunk, internal thoracic artery, and then the vertebral artery. The second part of the subclavian artery gives rise to costocervical trunk, which further divides into deep cervical and superior intercostal artery. The third part gives rise to dorsal scapular artery. We can remember all the branches of the subclavian artery via a mnemonic that is vitamin CD, VIT-CD. Now talking about axillary artery, the axillary artery is the main arterial supply to the upper limb, a direct continuation of the subclavian artery. It begins at the lateral border of the first rib and ends at the lower border of the teres major muscle. Its course is conveniently divided into three parts based on its relationship to the pectoralis minor muscle, which is anterior to the artery. The first part is the superior to the pectoralis minor. It has one branch. The second part is posterior to the pectoralis minor. It has two branches. And the third part is inferior to the pectoralis minor. It has three branches. The first part gives superior thoracic artery as a branch. The second part gives thoracoacromial artery. The thoracoacromial artery further gives clavicular branch, acromial branch, pectoral branch, and deltoid branch. The second part also gives lateral thoracic artery as a branch. The third part gives rise to anterior circumflex humeral artery, posterior circumflex humeral artery, and subscapular artery. The subscapular artery divides into thoracodorsal artery and circumflex scapular artery. The brachial artery is one of the principal arteries of the upper limb and is a continuation of the axillary artery. It begins from the outer border of the teres major and continues till the cubital fossa, where it bifurcates into the radial and ulnar artery. The branches of the brachial artery are profunda brachii. The profunda brachii gives a radial collateral branch and a medial collateral branch. Other branches are superior ulnar collateral artery and the inferior ulnar collateral artery. The brachial artery terminates in the cubital fossa by bifurcating into radial and ulnar artery. That's it for this video. In the next one, we'll be talking about the anastomosis around the elbow joint, the radial artery, the ulnar artery, and the arteries of the hands. Also, I would really like to have an honest review of how are you guys finding my content. Is it really helping you? What are the topics that you would like me to cover? And what changes should I make in my approach? So kindly give me an honest feedback. Would be really waiting for that. Thank you for watching. Please do like, share and subscribe. I hope you have a good day ahead. Thank you.